Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech Product Manager Parker Anderson, as always, joined by RipsyTech founder and CEO, the illustrious, love to use that word, Tom Tarshis. Hi, Tom.
Hey, Parker. Although you've used that adjective a lot. I think
Yeah, maybe I should be changing it up every week.
Yeah, let's get the thesaurus out. And I think, maybe I'll do the intro in a couple weeks.
There you go.
Because I never get to introduce you, right? It feels unfair.
Oh, that's nice of you. I appreciate it. Well, this week we are covering a fun little topic. We want to talk about contract work versus W-2 work. There's a lot of different ways that this might be set up for somebody. This could be that you're, moving my microphone here. This could be set up so that you're a W-2 employee for yourself, a W-2 employee for somebody else, or you are a contract worker for yourself or a contract worker for somebody else. There's a lot of different variations here. So before I dive into the questions, anything you want to any prelim thoughts that you want to put out there, Tom?
Yeah, and I think, this, with the rise of telehealth and now a lot of opportunities for all sorts of mental health clinicians to do a couple hours a week for 6 different agencies, you do see a lot of 1099 or contract work opportunities available now. And I think historically there was, the 1099 work was very commonly available for some psychiatrists and nurse practitioners, where you would maybe be at an entity and the only one who could write prescriptions, and so you would be paid as a 1099. But I think telehealth landscape and all of these new entities has really makes this a more relevant topic, and there's a lot of nuances around being a W-2 employee or 1099 contractor. That can be good or bad for you, both as the business owner or the employee. So I'm excited to share what I know. I certainly don't claim to be a expert, of course, but have learned a lot by being in all these situations over the years.
Yeah, so let's cover this from one angle first before we then transition to talking about the other angle. So let's first just start with the differences of working as a contractor versus a W-2 employee, and let's start with for a solo practice.
Yeah, so whenever you start a business, the most common thing that people do is on your personal, if you're the only employee and it's your business, you can just file a Schedule C on your tax return where you list the income that you earned from your solo business and you list your expenses, and then that is treated as income that's then taxed at your personal income tax rate. You're also charged and that's like a fine way to do things. You're going to be the taxes that you're going to pay are going to be higher than if you went through the steps to incorporate a business and pay yourself as a W-2 employee. So in which case taxes on businesses, there's ways to arrange it and ways to arrange your salary where you overall pay less taxes for the money that you earn. But that's, people have been doing this. If you have my spouse, for example, teaches one class at UC San Francisco over the year, and they pay her a stipend, or as a 1099 contractor, a couple $1,000 for that gig. And so that goes on the personal tax return as earning $2,000 or whatever it is. And then she's eligible to deduct any expenses from doing that work, which, you can deduct mileage for if you have to drive for that, if you have to buy some materials. you could even theoretically say she has to have an email account and phone for the people at UCSF to offer the work, and and whatever you can justify as a business expense could conceivably go against that earned money, and then you're just paying taxes on your business revenue.
Okay, so you could incorporate a business, or you could not incorporate a business but file as a Schedule C when you're doing your taxes. Is it possible to not file as a Schedule C? I guess I'm not privy to what Schedule C actually means, so wondering if you have any insights there.
Yeah, and that's the if you just are earning a little money on the side where it's really not worth doing a ton of effort, and potentially you don't even need to file for a different tax ID number, you just use your social security number, then that's what the Schedule C is for. So it's essentially being a 1099 contractor, where if it's a minimal amount of money that you earn, this is really the right way to do it, because other methods are going to take more time and effort, and your time is worth money. So it's a very straightforward process to do that, and it's very easy to just even Google Schedule C and read about that.
Right.
I think if you're, though, deriving the majority of your income, it gets different, and it's worth putting some thought into strategies around whether you should be incorporate something that can pay yourself, that can pay, quote, employees, which would be yourself as a W-2 employee, or if you're just going to still incorporate the business but pay yourself as a 1099 contractor through the business, both of which are different than just doing a Schedule C on your tax return.
And then we've talked about in the past, you're talking about incorporating a business. I know we've used the term S Corp before in the context of running a mental health practice. Where does that fit into that picture?
Yeah, and again, without going into too many details, there's different structures you can set up for businesses. There's S corporation, which is common for businesses with, well, I don't want to misspeak, I'm no expert, but I'll say that I've seen this mainly in businesses that maybe only have a handful of employees, or more common if it's even one employee. And it has to do with different tax rules and other items. But if you make any type of corporation, then you can use that corporation to decide how to pay people working for the corporation. The C corporation is more standard for when you're going to have lots of employees, and you need to have a system in place for dealing with the large numbers of the employees and following federal rules and other items. Now, definitely, I've also seen very large companies that are set up as S corporations, LLC, limited liability corporations, and I'm not an expert on a lot of those pieces. But in any situation, once you've set up a corporation, which it is advised to do this if you're a mental health practitioner, that this is your main income, because it does afford some extra legal protections, i.e., when you're just doing something as a Schedule, if you're reporting all your income from seeing patients as a Schedule C employee, you're potentially setting up your personal assets to be liable in a lawsuit. So setting up a corporation, this is a drastic oversimplification, but setting up a corporation that you get insure against malpractice via the corporation, and then the corporation's employees can give that layer of protection against your own personal assets.
Sorry, go ahead. Were you going to say something?
Oh, yeah, which, if you're just, working for yourself under your social security number, yeah, you can still get a malpractice policy, but if that malpractice policy's limits are met in a settlement, then they can come after you personally. And that, we shouldn't live in this culture of fear, but, you don't want your house and life savings to be jeopardized by something that happens at work.
Right. Okay, so let's. I feel like we've kind of talked about we've talked about a lot. We wanted to start at the, I guess, like the individual level. If you're running a solo practice, what's the advantage of either or? I feel like we branched out and we talked about a lot with if you're just running a business at a high level or and at a small level. So I think maybe let's talk about the experience of somebody who's thinking about joining a group and they are presented let's say they've been hired or they've been offered positions at two different groups. One group is offering them a W-2 position and the other group is offering them a 1099 contract work position. What are some factors that they should be considering when making that decision?
Yeah, perfect. And yeah, this is a great question and a good way to talk it through. And I'm going to asterisk it for a second and just talk about the, quote, legal definition of W-2 versus 1099. And we may have mentioned this on one of our other podcasts earlier, but the idea of when a business says, hey, come work for us as a contractor, for a business to be able to pay someone as a contractor, they need to be able to show that this person is bringing in some skill that does not exist in the business and that you're entrusting them as an independent contractor to come in and get this task done through this skill that only they have. And so it might be, hey, we run we can, keeping it with what we've talked about, it can be maybe be a group, community-based organization that sees a lot of patients but only hires therapists, and they need a prescriber to come in. The idea is that there's not going to be someone already at the clinic that could tell the prescriber what to do or how to prescribe the medicine. So it's an outside person coming in with expertise that the current clinic doesn't have, so they can say, we need you to provide services, but we're not going to tell you how to do that because you're the only prescriber. That's why we can pay you as a contractor. The difference there is if you're at a community-based organization that is started and run by social workers and they say, we're hiring a social worker to come in as a contractor, that likely, and this is all great, can be gray area, but that's likely not the right use. They're likely not really supposed to do that because it's an entity that is run by and started by social workers. If they're coming in to see patients and there's other people who have expertise in seeing patients there are some rules around seeing what you're doing. Like, yeah, you can't take the patient out for a 2-hour walk every day. Then it really doesn't meet the definition of contractor, and that should be more of an employee. So an employee is someone that is going to report to someone and has to do things a certain way as dictated by your business. A contractor is someone who comes in to do something that your business doesn't really do. So you're expecting them to get it done however they get it done, and that's the important distinction.
Interesting. Okay, so go ahead.
But most people have maybe heard of this. This has got a lot of attention in California with Uber, with rideshare companies.
Oh yeah.
Where it is advantageous for businesses to pay people as contractors, which starts to feed into the actual question. And so the lawsuits were brought saying, hey, these rideshare drivers, they're really employees because, you're giving like a lot of directions in what to do and you're looking into how rides went and getting ratings. And it was actually, that was the legal challenge, but then it went to the voting and through vote, they were allowed to stay as 1099 contractors, which just helps the rideshare companies.
Right.
And we'll get to talking about why that is.
I think at that time, anybody that I talked to who was like a very deep businessy, financy kind of person, really they're like, oh yeah, they should stay 1099. That's how you run the business or something. But well, I won't name any names. But okay, well, we're talking about challenges that contractors face. So let's keep talking about those. And are there any benefits to being a contractor?
Yeah, so sort of going back to the question, yeah, and let's take it by contractor versus W-2. So if you're like a contracted employee, it tends to be you get paid X for doing Y, and that could be like a 53-minute therapy visit. You're going to get $75 for doing those visits. You count up how many of those visits you do in a week. If you do 10 of them, here's your check for $750. And then you deal with everything that comes from taking that check for $750. The thing that's nice for businesses then is that's all the business has to outlay is that $750. And versus for W-2 employee, it's different. So as the person working as the contractor, the potential advantage of being paid just like for the flat rate is that if you are, again, we alluded to this a little bit with the example of deductions, but if you're savvy at taking a lot of business expenses, then you can really lower the total amount of income, even though you're getting more. And then if you're getting more money, you could actually wind up with more salary in your pocket. When you're getting your money as a 1099 contractor, you yourself have to pay all of your Social Security and Medicare tax. Mm-hmm. So that is 15.3% of every dollar earned in the country needs to go to Social Security and Medicare. When you work for someone as a W-2 employee, your W-2, the business is paying half of that. Right. So that's like 7.65%. So when you decide to work for yourself, you're immediately losing 7.65% of that money that would be covered by your employer. Mm-hmm. There is like a deduction you do get for half of your self-employment tax, it's called. So it's not exactly that amount. But one of the biggest advantages for corporations is they're saving 7.65% on everyone's paycheck because they don't have to pay that employer portion of taxes. So you got your check for, let's make the check $1,000 just to make it simplify it. So 15% of that's gone. So your money's down to $850. Then you have to pay federal and state taxes, and we'll use the tax upper federal tax bracket is 32 or 33%. But let's say someone's just in a 20% federal tax bracket. And so say you're losing another 20% of federal taxes. So now you're down to $650. If you live in if you live in Texas or Alaska, you don't have to worry about state income tax. But in California, you're going to be dropping another 5 to 10% of that to state taxes. So now your $650 that we'll put it down to we'll call it $600. You've lost another because of the other taxes. And then you're just left with that $600. So you've already given 40% of that money to taxes. But now at this point, this is where you can maybe drastically reduce the income on that $600. So if you say, okay, well, I work as a contractor, but I need to pay for high-speed internet. I need to pay for this new computer. I need to use my cell phone to text message the agencies I'm working for. You might be, and I have this dedicated room in my house, which is just only used for my work. Then you can deduct all of those costs, including like if your house is 2,000 square feet and you can say this 200 square feet is for work, you can deduct that portion of your monthly rent or mortgage. There are rules where, if you're only using it for work 20% of the time, you're not supposed to do that. But But that's where someone and if you're paying for your own health insurance, you can deduct that cost as well. So this is where if you're very savvy at categorizing all of your expenses and keeping those records, you may get to keep that $600 and only have to pay tax saying your income was only $100. And that's where this advantage of being the 1099 contractor can come in. So even though you take a hit on the not getting coverage for the employer taxes, you can, if you're good at doing the write-offs, you can actually end up with more money in your pocket.
This is making me realize I probably should have written off more stuff when I did 1099 work, but
you were doing, and that what you mentioned, right, is people. It's human nature for people not to do this, right? So it does take a lot of extra work and time and some record keeping, and there's a whole bunch of psychological research on. It's like mailing in a rebate. There's so many rebate coupons because the reality is like only 10% of people actually use the rebate coupons.
Right.
So,
it's probably different in the context of providing mental health services, but I know that when I speak with some of my friends who work as designers, as contractors, they talk about like, well, okay, there might be when you're thinking about the hourly rate that you charge your client, you do need to be thinking about, the time that you spend communicating with the client or the time that you spend planning what the design is, and not just necessarily not necessarily just the time that you design. Yeah, you might be charging for that time specifically, but when thinking about the rate that you charge, you need to be thinking about all of the extra time outside of that time that you're being charged for that you're actually spending doing things that do contribute to this. And so there's just ways to justify increasing the rate that you charge as a contractor based on, also, all those self-employment tax reasons that you mentioned as well. So I don't know if that's useful in the context of a therapist, but it's certainly something that we think about in the design world.
Yeah, no, and this is what makes it another advantage for the businesses to pay people as contractors for like a direct service, because the reality is you might be answering an email or writing a letter, or you're probably going to wind up doing some stuff above and beyond for your patients that you might not be able to get any reimbursement for. And so it is, there are groups that say, in addition to your $75 per session, we're going to give you an extra $150 a week to cover some of these different tasks. But there are lots of places that know it's just you're getting paid for your time in therapy. But we all know that patients, there's always stuff that comes up in between or extra work that you have to do. And, I think people who go into mental health fields, it is a helping field and they're passionate about it. So it can be a way to sometimes open yourself up to being taken advantage of a little bit. So, it's something that if you're going to do some of the 1099 work, to think about those things and make sure, ask for getting an extra hour or two paid for if you're going to be doing some of those tasks. The other key piece to being paid as a 1099 contractor is you are not going to get any PTO for vacations or sick days.
Yeah, I know that one.
You're not going, you're not going to get reimbursement for going for a conference, although that is an expense that you could deduct theoretically to keep up your continuing education. But a lot of the other, we already talked about health insurance, but there could be a long-term disability insurance, dental insurances, little life insurance plans. There's lots of other benefits that are offered by employers that if you're working for yourself, you've got to be in charge of your own benefits. Some people will say that, they're happy with this because they don't need some small life insurance policy, or you can customize the benefits that you need for where you're at in your life. or if you've got a partner who has really good health insurance coverage for the whole family, that's a very strong argument for, if you don't need health insurance through your own business, then that could be very logical and a money saver to work as a 1099 employee.
Right. Gosh, there was something I was going to say, but it's escaped my mind.
And then one other potentially big one is, if you're a 1099 employee, you're not eligible to apply for workers' compensation, right? You're not eligible for a lot of other employer-employee protections, and freedom. Some things you could still make a case about, but in general, the employer's off the hook for a lot of things that if you were a W-2 employee, they would have to cover for you or could be responsible for.
I remember what I was going to say now, which was, back when, so I used to split my income, W-2 work and then 1099 work, split equally. The 1099 work, if I had the day off for the W-2 position, that's great. I'm still going to get paid for that day. But for the 1099 position, that's just a day that you don't get paid. So, it was great. You get a little break, but at the same time, it's money that's not in your pocket.
Yeah.
All right, great. Well, I'm looking at the rest of our questions here. My gut tells me that we've actually answered these, but let's take a stab at it. Let's see. The next one is about structure and support for a W-2 employee. Anything on that would be good to say that we haven't already discussed?
Yeah, I think switching over to the, if you're the practice owner and you've gotten busy enough to where you're gonna hire an assistant, and you don't want to use one of the sort of third-party virtual assistants that you can, where they're employees for someone else and they do the work for you. But if you're, want to have your own employees for your business, the more employees that you have, it does open you up to some like discounted rates on health insurance policies.
Oh.
It does sort of give you more credibility as a business. There are some tax breaks and some other things that come with being an employer. And a good example was with the recent pandemic. If you were a small business owner, had some employees, you had a lot of incentives available to you. And this includes like SBA loans and other features that come with being an employer that employs outside people. I think for mental health professionals, like if you're deciding that you're going to bring on some other mental health professionals and you're deciding between should I bring people on as contractors or bring them on as W-2 employees, in general in mental health right now, somewhere between, if you go to work for someone, you earn that you earn that company $100 an hour by doing a therapy visit, they're probably going to offer you somewhere between $60 and $70, 60 and 70% of that if you're being paid as a contractor. However, you're coming on as a W-2 employee, it's going to be more like 50% of that is going to go to your salary. And then that other 10 to 20% that you would have taken home as a 1099 contractor, the company's going to use that for the benefits that they're offering for the employees. So some of that's going to go into a vacation pool. Some of that could go into the health insurance pool. And so that when you're setting up your business, those are general like percentages to think about for the costs of your employees. And if you're an employer that doesn't have robust benefits set up or doesn't want to deal with that piece and doesn't want to deal with things like, at some point you need to have your employee handbook and other things when you're having employees work for you, then that's why you give the higher percentage of the pay to the 1099 contractors. And I think it's people tend to underestimate the benefits that they get from being a W-2 employee.
Mm-hmm.
And people tend to, when you work for someone, the thing that makes the biggest psychological impact for you is what's that number that's deposited into your bank account.
Right.
So oftentimes it's very hard for any of us when they hear their friend, getting paid, right, 50 versus 70, that's like an extra 30% higher for doing the same work. They often don't think about, oh, well, I got these vacation days, or I have this health insurance, or I have this conference expense. So it's important as a business owner that if you are going W-2, you make sure to educate your staff on the value of the benefits that they're getting by working for you. And that's not always super easy.
Yeah, I mean, in general, it seems like there's a lot more protections as an employee if you are paid W-2, whereas if you're working 1099, I guess, like, if for some reason somebody no longer has contractual need for your services, or you've completed a project, it might be a temporary setup, whereas this is a long-term relationship that you're entering in with your employer when you're working as a W-2 employee.
Yeah, I think that's generally very true. And I think there's a little misconception that if you're only doing 5 hours a week for someone, like, you have to be a 1099 contractor. And that's definitely not true. You could work 1 hour a week and still be paid as a W-2 employee.
Mm-hmm.
Like, it doesn't, it is legal to have things go both ways, and there's no minimum time to work for a company to be considered a W-2 employee.
Now, actually, this is making me think about something else. So I know that there are rules around if somebody's working 20 hours, they need to be considered. There's like benefits that need to be offered to them. Is that, or I don't know if it's 20 hours is the cutoff, but I know that, like, there's a difference between part-time and full-time when you're working as a W-2 employee, and there is a certain, I believe, like, legal threshold in which you need to be offering more to that employee as an employer if they're working a certain number of hours. Am I correct in that?
I'm not, there are sort of state-specific laws around if an employee works this much for you, you have to do this for them. And California has a lot of these where, yeah, if an employee is working X hours, and it might be done weekly or monthly or yearly, you need to give them 7 days of sick leave. So a lot of this came with COVID also, right? Mm-hmm. With, oh, you can't come in, you're fired. And I don't even think the law I think California said you do have to offer a few, like, paid days, but I don't think that's always entwined in it. What I will say is what I've learned over the years is the biggest thing with giving benefits is you have to make one policy that's consistent. So I know that when we're signing up for health insurance, you can offer it to anyone, no matter how many hours they work, or you can set a threshold of 20 hours a week or even 30 hours a week. But regardless of what you do, you can't, like, it has to be the same for every employee, no matter what they're doing for you.
That makes sense.
That's I think that's the main thing that I'm very aware of.
Gotcha. Okay.
So for RipsyTech, we offer our health insurance there's no minimum hours you need to work in order to participate in the health insurance. It's also a false belief that you can't offer your 1099 contractors health insurance. You actually can. You can say that health insurance is open to W-2 and any 1099 contractors.
Huh. I did not know
which
that.
I just found out. Yeah, and I found that out recently. But yeah, so consistency is just you set the policy and you treat all employees the same to avoid discrimination issues.
Yeah, I mean, and that sounds like the fair and just thing to do. We function off of doing the right thing, or at least that's how we try to set things up. So that sounds like a good thing. Okay, before we dive into the mental health business moment, is there anything else that you want to talk about on the topic of W-2 versus contract work?
No, and I there is definitely a lot of nuances to the W-2 versus contract, and I think the being thoughtful about both how you're paying yourself if you're just a solo practice, being thoughtful about if you're going to pick up a few hours a week to fill some holes while you're building up that private practice, being thoughtful about the pay and that are you being fairly compensated, and and then I'm always, as always, I'm happy to try to lend insights on any specific situations that you might find yourself in, and it is, if you are going to do 1099 work where you need to track business expenses very carefully for that personal deduction, then make you that sheet and do it on a daily basis to avoid trying to scrambling at tax time to figure out anything you can to deduct. So that's my other advice.
That is great advice. Okay, excellent. So let's move things along to the mental health business moment. What are we looking at this week?
Yeah, I think it's a pro and con business moment of the week. It's back to, of course, one of the favorite topics, which is dealing with insurance companies.
That was going to be my guess. I was about to interject with a guess. Okay, got it.
And we just completed our negotiations with an insurance company that went very well, and we're happy to be in network with them in another month. And I don't know the exact relationship between these two insurance companies, but there is some sort of partnership. And when we were finishing the contract for one group, they said, "Hey, would you like to explore going in network with this other group?" And I had asked, like, "Oh, well, are they going to reimburse about similar rates?" And
right.
It was implied, yes. And so I said, yeah, that you can go ahead and give information and they can contact us. And they did contact us. But then, I always like to negotiate the rates before you do anything, because I don't want to spend a lot of time filling out forms and information and submitting a roster if we're not going to agree on the reimbursement rates. Mm-hmm. But then, unfortunately, a lot of insurance companies now, are like, well, you have to complete every form and do every link and sort of sign everything, and then we can talk about rates. And so, like many years ago when we started this, we were able to sort of do the rates first, and now I feel like the insurance companies are taking advantage of chat bots and automated process to avoid that. So I was feeling, begrudgingly reluctant to complete all this paperwork when I'm not even sure we're going to come to terms with the contract. But I will finish the paperwork anyway. But
now, is the one that went well, does that relate to the business moment that you were talking about a few weeks back, where the irregular situation of somebody, a live human being, wanting to talk to you over video? Was it that situation?
It was, yeah.
Wow.
Yeah.
Excellent. All right. Well, a little up, a little down. Hopefully not too far down.
Yeah. Yeah. And I, for better or for worse, I tend to be efficient, or I've just done some of these paperwork things so many times. It's not too bad. In fact, the most frustrating initial thing was a lot of places want you to list what you're specialize in, and the list of things, it's an A to Z list.
Right.
They had it in a little box, and there are some things that feel very made up on that list. And as a mental health clinician, do you go through and check everything? And do patients even look at that? It
Right.
feels very extraneous and like busy work, but
I mean, yeah, there's I don't know if this necessarily pertains, but there's the issue of like having too many choices for something. And when last week's episode we talked about like is it good to have a specialty, and something I don't think we really quite touched on was if I go to Psychology Today and I'm looking for a therapist and I see their specialties and there's like 20 things on that list, that might actually give me a different impression of that person if say one thing I'm looking for is on that list, but say somebody else, they have their own list and my thing's on that list, but it's only 3 things long. That might make a difference in what I choose. So yeah, that's a good point. Like, is it to your advantage to choose all of those things? This is in an insurance context, so slightly different, but good food for thought.
Yeah.
All right. Well, go ahead.
I do question the usefulness of if you've got a list of 120 things mental health professionals treat.
Oh yeah.
But both when you're filling that out, it feels, things that you can treat, you want to make sure that you check, but then it just starts getting ridiculous after you've checked 65 things, and that doesn't feel very helpful on either end.
Well, I think it's I think a very relatable analogy is when choosing something to watch on a streaming service, and if you I'm very specific. I have a list of things of like, these are the things that I want to watch. So when I sit down and I need to make a choice, my selection is very limited. But if I'm sitting with my partner and it's like, oh, what should we watch? We'll spend 2 hours finding a movie to watch in which we could have been watching a movie, So I think that's like a good example of where having fewer choices can be to somebody's advantage.
Agree completely.
All right. Well, there you have it. Thank you for joining us on this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you have questions you would like to submit to our audience Q&A or are interested in featuring as a guest on the show, send us an email over at sitandstay@ripsytech.com, and we will see you later. Tom, great episode.
Thanks, Parker. Have a good one.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.